All right, it looks like we've reached the top of the hour. Hello, everyone, and welcome to part one of our webinar series, Activating Your Assessment, a Conduent Healthy Communities Institute webinar. My name is Zach Flores. I'm a project coordinator here at HCI, and I'll be your facilitator this afternoon. I know we have a very limited amount of time together, and we have so much information to share with you all, so I'll get right on into it with just a couple of quick housekeeping items. You've all joined as an attendee, so you're all automatically muted for the duration of the webinar, but if you have any questions as our presenters go through the slides, definitely please feel free to type them into the bottom right-hand box of the WebEx window located within the Q&A box. And I'll be monitoring your questions as they come in, but please make sure to select the All Panelists box when submitting them so that our presenters can see them too. We'll try to answer as many questions as we can throughout the presentation, and we'll make sure to bring them up to the Q&A session. And I just wanted to make one final note that there will be a recording made available to you all following today's webinar. As I mentioned before, I'm Zach Flores. I'll be playing the facilitator role today. And now I have the privilege of introducing our two presenters for today. First off, we have Tracy Van. She's a senior advisor here with HCI. Prior to joining HCI, Tracy spent over 25 years working with not-for-profit healthcare systems in the area of community benefit compliance, community health improvement strategy and evaluation, as well as cultural competence and diversity. Next, we have Ashley Wendt. She's a public health consultant with HCI. Ashley brings us over 15 years of public health experience to the Conduent HCI team, including domestic and international public health work. Ashley earned her Master of Public Health degree from Tulane University, and we're very lucky to have both Tracy and Ashley on the team here at HCI and as our speakers for today's webinar. Now that we've introduced ourselves, at this point, we'll be turning off our webcams in order to maximize the audio quality for the remainder of the presentation. So for those of you who aren't familiar with who we are, HCI has been a leader in the community health field for over 10 years. We've conducted over 200 community health assessments and implementation strategies with partners all across the country. We also provide strategic direction for community health initiatives, and we're known for our award-winning customized technology platforms. Along with powerful analytical tools, our platforms provide access to continuously updated population health and socioeconomic data to help tell your community story. Like Ashley and Tracy, HCI's employees bring both a combination of advanced public health degrees and real-life experience in community benefit and population health. On this next slide, we've dropped in some brief information here about our webinar series and what each of the three parts are focused on. For today, Ashley and Tracy will be sharing some of the trends that we've been noticing, as well as general best practices for your consideration while you complete your next CHA or CHNA. And with that, I will pass it over to Ms. Tracy Van to take a deeper dive into the objectives of our webinar today. Thank you.
Great. Thank you, Zach, and welcome everybody. Thank you so much for taking some of your valuable time to join us today. We have what feels like a very short time with you and a lot to cover, so I'm going to jump right into it. Today, we want to talk about how to activate your assessment. So we're going to focus on planning and managing an efficient assessment process that meets both federal reporting requirements or, for our public health colleagues, accreditation standards. We want to talk about how to anticipate challenges and incorporate best practices, and then the all-important engagement of partners and stakeholders, and especially how do we engage these folks effectively in an evolving and uncertain environment? So we ask ourselves, what's contributing to these uncertain times? And here's a few recent situations that I'm sure will resonate with all of you. And as we're trying to stay focused on our jobs and deal with other issues that arise, like pandemics and social unrest and ACA challenges in the Supreme Court, we still find ourselves having to meet IRS reporting and assessment requirements. And for public health, we still find ourselves focused in on FAB accreditation standards. So as we get started, I thought we would show both hospital and public health, for the hospital and public health representatives that are on the call today, we have a nice mix. we thought we'd show the IRS CHNA requirements side by side with the FAB community health assessment requirements so that you can see the similarities in these two areas. A trend we're seeing over the past assessment cycles is this greater collaboration between hospitals and public health. I'm sure there's a lot of you on the call today that are living that collaboration and are actually participating in those types of activities. There's truly this increased appreciation for the role that each hospitals as well as public health play in the community, and this greater understanding, especially since the recent pandemic, of how each benefits the community. There's a greater focus on leveraging resources and expertise and working collaboratively with partners to enhance the overall health system in a community. So regardless, if you're trying to meet IRS reporting requirements, or if you're focused on FAB standards, for the sake of our discussion today, we've created a community health improvement overview graphic. And we want to say that we realize that the wording on this slide may not perfectly align with the IRS and the FAB wording, but we hope you'll see the continuity within the activities of each phase to understand how it relates to your specific assessment needs. We're going to briefly cover each of the phases during the webinar today and share some challenges and trends and best practice examples where possible. We want to first start off by pointing out that community engagement must be at the center of our assessment efforts. But actually, let's see. I'm sorry, we want to hear from you. We are going to ask you to use your chat feature. And as we go through these different phases of the assessment process, we'd like you to share if you've had particular challenges and came up with solutions to those challenges. And this way, the chat feature is for everybody to see, and you get a chance as we're talking to also share some of your experiences and insights with the colleagues on the webinar with us today. So while you share your while you're sharing those features, we're going to go ahead and share with you what we're seeing as far as challenges and opportunities. So we're going to go ahead and populate this slide with some of the challenges that we've seen. I'm not going to go through all of these because we're going to go through each of these phases individually in a little bit more depth. But what I can tell you is, having conducted over 200 community health assessments and helped with implementation strategies and community health improvement plans, there's a farmer's commercial that comes to my mind that shows all these crazy claims that they've paid. And they say, at Farmers, we've seen a thing or two. And that is certainly the case for the HCI team. So while our assessment process is pretty consistent, we know that the communities we work with are unique. And it's important to be flexible and adaptable within each of the phases. So as a team, we debrief and we share lessons learned with the goal of making the next assessment process run as efficiently and effectively as possible. And we've taken that knowledge and we've put it into the development of this webinar series for you. So let's take a deeper dive now, and we're going to start off in this first phase of planning and organizing. It's in this phase where relationships with our partners are so important. It's as important as that continual community engagement that we talked about and we emphasized at the beginning of the process. It's important to nurture relationships with partners to build trust and uncover shared goals and objectives. And these relationships can also be very beneficial when unforeseen circumstances hit your community, like a pandemic. I'm going to turn it over to Ashley now and ask her to tell us some of the experience she's had recently out in the field.
Thanks, Tracy. I think one big lesson that we took from this process was that COVID really shifted everyone's priorities and focus. When we worked with the Cane Help Collaborative in Illinois, for example, the community partners were really engaged and eager early on in the process. But by the end of the year, if it really wasn't COVID related, it was harder for them to find the bandwidth to fully and continually provide feedback and support because their focus was elsewhere. And I think because of this, it's important to keep partners engaged early and often so we can move our assessments forward with more fluidity without overwhelming our partners and ourselves when we have to put our community's immediate well-being first. It's important to establish and maintain these partnerships and relationships early on to add continuity in our assessment processes so we're not starting over from scratch every time, because really these processes, I think, should build on one another. However, if you haven't been engaged with partners like this in the past, I think your next assessment cycle creates the perfect opportunity for you to do so. So think about bringing in new or existing partners into your assessment planning at the start. Whether you're an official collaborative or not, they can be crucial partners for providing perspective, collecting community feedback, as well as identifying and partnering for implementation. So moving on to the next slide, we're going to share some of the best practices to address the challenges of leading an effective and efficient assessment within the areas of process, expertise, and time. So when we think about process, again, we're talking about collaboration, and I think it's important to really clearly define roles and responsibilities for yourselves and your partners early on, and that's really key to moving on to have a project that's effective and efficient. When we think about expertise, given the different types of expertise that's needed to complete a community assessment and the strain on your time trying to add one more thing to your already busy plates, you may try leveraging internal expertise within your own organization or partnering with local partners. And some of you may even think about partnering with an external vendor. And if you're going to think about partnering with that external vendor, I think it's good to keep some of these things in mind. Working with someone who has expertise working in the community, a similar type community that's similar to yours, whether that be rural or urban. Looking at the previous assessments that they've conducted, are their reports written in a way that the information is easy to understand? Are their methodologies clearly stated? Is that data actionable and even relevant for your community and for your organization? And if you're a part of a collaborative effort, really making sure that the vendor is experienced partnering on a collaborative assessment, because that adds extra layers of complexity to a process. So we've talked about process and expertise. And the third area here is time. With time, it's important that you start early and develop a detailed timeline so that everyone in your collaborative are on the same page with the anticipated deliverables, and ensure that work that's going to come out of this process is meeting everyone's needs. So if you're part of a collaborative, for example, that's made up of a health department, a handful of hospitals, as well as community organizations, you really want to meet at the beginning of that process to ensure that everyone's needs related to their assessment and their evaluation is being met. So I'm going to turn it over to Tracy now so she can walk us through a little bit more information about collecting and analyzing data related to our assessments.
Great. So hospitals and public health assessments include, as we know, collecting and analyzing primary and secondary data. And since most secondary data, which is data that somebody else is capturing, is only updated once per year, or sometimes longer, you have to remember that there has to be a lag time. So during times when your community environment is changing or has changed drastically, using primary data like focus groups or key informant interviews can provide a more current view of a community's needs. Health departments can also tap into surveillance data and vital records to help get a snapshot of what's happening. During the pandemic the last year, we found this was particularly useful and valuable, this focus in on primary data. And Ashley, I know you were at the forefront in communities leading some of this work. So I'm going to have you share some more of the best practices around that with us.
Thanks, Tracy. Early on in the process, particularly when we were working during COVID, there was really a need to modify our data collection tools. And we worked with our partners to build in additional questions within our primary data collection tools that included key informant and focus group facilitation guides, as well as our community surveys, to better understand our community needs and hear from the community members, specifically related to how COVID was impacting them and their communities. We also worked with our partners to enhance their marketing and promotion of their community surveys, because we really wanted to ensure that we were layering in more diverse voices within that process. On the next slide, I want to talk a little bit about some of the considerations as we had to shift from hosting in-person qualitative data collection to virtual qualitative data collection, as many of us have had to do with our work or with our children in school. it's a steep learning curve to have to make that shift sometimes when we ideally want to be able to host those focus groups in person, sit down with a community, having a really meaningful conversation. So shifting that online, we have to think about internet access and the quality of that access, technology literacy among the population and the communities that we're trying to communicate with and meet with. Think about those community members' availability if they're working from home. Do they have kids at home or other constraints on their time that would make it challenging for them to be able to log on and participate? Camera versus no camera. I think that's a controversy in all of our environments right now, school, work, and it's no different when we're thinking about community qualitative data collection. Obviously, we would prefer to have our camera on in this situation, but it's good to ensure that our community members are feeling comfortable. And if you have a call-in option that they prefer to use instead of sharing that camera, it's good to offer that. I think there are benefits too. We saw that there is more accessibility when folks are able to engage virtually as compared to having to drive in, where they may be limited in accessing it because of transportation issues, or it may be too far for them to drive in wherever we're hosting that session in person, or they may be having to arrange care. So a lot of those barriers go away when we switch to that virtual format. And so I think that's a positive. Moving on, I want to talk a little bit about health equity. Health equity has become an increasingly important lens through which to view health, including how to approach public health and community health work. And in a recent January 12th Health Leaders article by the Business Group on Health titled 5 Healthcare Trends to Follow, addressing gaps in equity was included as one of those top 5 trends. We've also seen some upcoming changes to the Mobilizing for Action Through Planning and Partnerships, or MAP process, that is of particular importance to our health departments. MAP is a framework for community health assessment and planning developed by the National Association for City and County Health Officials, or NACCHO, and the CDC. And equity and community power building is being placed at the center of this process. And I'll refer you out to the recent January 16th NACCHO webinar titled MAP Evolution, a Blueprint for the Future, as a really great resource to walk you through some of these upcoming changes. So when we apply an equity lens to our work, it's important to examine disparities within our data as well, breaking out analysis by gender, race or ethnicity, or even geography if we're able to do that. And it's also important to collect data concerning the broader things that are impacting our communities. We know that COVID-19 has exacerbated many of the health needs and barriers that are usually highlighted in our assessment processes, and has disproportionately impacted our Black and Brown communities. But we've also seen increased need and access to health services as individuals lose jobs and employer insurance coverage. There have also been increased needs for food and housing support as a greater number of individuals face food and housing insecurity. Some for the very first time. So this is putting increased pressure on already strapped community organizations and challenges individuals and families who haven't had to navigate these waters before. And it's important that we analyze these social determinants of health to understand this broader context and challenges our communities are facing. And finally, I think integrating our clinical data when available with population and community data is another great opportunity to gain a more complete understanding of what's driving health in our communities. So Tracy, what perspective can you offer on contextualizing our analysis?
So Ashley, before I jump into that, we did have a question come up that I think is related to this health equity lens, and that's about some strategies to make sure that we're engaging diverse voices. And I think I want to answer that by saying this is where that relationship with your community partners is so key, in understanding what are the demographics of your community, what's the breakdown, who are those partners that are serving the various subpopulations that you have, so that you can make sure that you've got those voices at the table. We can certainly touch on that a little bit more at the end of the Q&A, but I did want to acknowledge that question that came in related to health equity. So now I will talk a little bit about contextualizing the analysis. So what we mean by that is to consider what might be happening during the assessment period that should be taken into an account. So we've given examples like the pandemic, or where there were prolonged interruptions in maybe access to health or social services due to demonstrations related to social justice, or perhaps a large-scale disaster. I mean, anybody that's visiting here or joining us here from Texas, I know you all have a recent disaster that's very front and center in your mind. So consider using additional data that you can tap into. There may be some local resources that are more up to date than that national data, which we talked about tending to lag. Check with partners to see what data they might have available to you. And this is where even anecdotal type data can help provide insight into what's occurring. On the screen right now, I know it's kind of hard to see, but the right-hand side of the screen is a pullout from what we call the COVID snapshot from a recent CHNA that we completed for a client, where we looked at food insecurity, mental health, and older adults and aging. And we used a lot of local resources to see what the impact was on that community. So just a way to tap into those local resources to get that added context for your analysis. From there, we move on and we think about leveraging our analytics. And what we're seeing in this area is this renewed interest in using vulnerability or need indices that help synthesize multiple indicators into one value to help better direct action. So the list on the left is some indices that HCI created and use in our analytics, excuse me. The image on the right is of a recent HCI Food Insecurity Index. This is an example of one of these that's on one of our client platforms, and it shows the darker area indicates more need around food access, which of course we all know with COVID has really been highlighted. So I want to just put a little plug in for webinar 2 and tell you that webinar 2 is going to go into much more depth around data and analytics by focusing on community health dashboards and how to ensure your assessment's a living document. So more to come on that. Let's move now to data synthesis and prioritization. So it's important to examine findings holistically. An assessment needs to consider not only what the numbers are telling us, but also incorporate what's the community saying. This Venn diagram example that you see on the screen right now is from a recent HCI assessment process, and it considers community input through key informant interviews, focus groups, and community surveys, along with secondary data, which includes reportable diseases, to help us uncover those significant health needs in a community. So once we've got the significant health needs, we move on to prioritizing those needs in order to focus our efforts. This slide includes some important considerations for prioritizing. In the past, we would conduct our prioritization sessions via an in-person gathering, but I'm sure like a lot of you over the past year, we've had to really adjust our approaches in order to make sure that we're meeting whatever public health guidelines are in a community for social distancing and keeping people safe. So considering some of those constraints and considerations that Ashley talked about using an online type version, we were able to successfully move our prioritization to include a virtual meeting and discussion followed by an online exercise. So everybody had a chance to provide some input. And we were able to customize this for clients that were doing a very small focus group of folks on the prioritization to clients that sent it out to and end up having 80 people in this virtual call and session in order to do prioritizing. So it can work for small and large groups. And just an important reminder, whether you're a hospital system or a health system, that both IRS and FAB standards, there is an expectation that community members are involved with both setting priorities and strategies for moving forward, which leads us to the next phase of activating findings. I'm going to turn it back over to Ashley to discuss this piece.
So in this section, we're going to briefly cover linking your findings to action, share lessons learned from COVID-19, and talk about creating actionable reports. So linking your assessment findings to action is, from my perspective, the most critical component. And as I've shared before, it's vital that we engage community members experiencing health inequities in program planning and development, that we leverage promising practices and evidence-based programming to optimize effectiveness in our efforts, that we use data that's available to focus on neighborhoods, geographies, populations who are experiencing greater disparities, and that we expand our considerations, not just for what is coming out as the key findings from our assessment processes, but that we commit to thinking about and addressing the root causes of these poor outcomes. So with COVID-19, and I got ahead of myself here. With COVID-19, we've seen something that has deeply impacted us personally and professionally over the last year. And it's been a theme we've woven throughout our conversation today. But now I want to talk specifically on a few lessons learned that we've learned through our work in the past year. And the first is areas for opportunity. There is opportunity to create better and clearer messaging and communication related to COVID-19 in our work efforts to avoid confusion and misinformation. There's opportunities to rethink programming and how we reach people where they are versus having them come in to access services. So utilizing satellite offices or mobile health units or even virtual health. And then, as we discussed, the exacerbation of those social determinants of health that we've been addressing. But I think some positives are coming out of this process as well. We've seen the amplification of telehealth and remote health use. One of the healthcare systems in Florida that I recently worked with saw a large increase in use of mental health services by families. And this increased because there was willingness to access these services on behalf of the parents and the children. And the virtual format removed some of the barriers like transportation and the need for after hours access. And I think our community organizations have really come together and worked quickly to address the immediate needs of our communities, such as the food insecurity among children who are out of school or seniors who needed increased assistance to access their medications. And I would also be remiss if I didn't mention the important role of our community resources, such as leveraging community health workers, because these can be important trusted bridges to the communities that we're serving. So now I'm going to transition it back to Tracy to close us out by talking a little bit more about the importance of creating actionable reports and tracking and evaluating our work.
Thanks, Ashley. And I do want to note, we've got some really great questions coming into Q&A. So I'm going to buzz through these next few slides as efficiently as possible so we can get into the Q&A section. But we all want our reports to be considered really a resource for the community, and it can serve as a guide to inform community efforts. It's really about putting data into action, but people need to understand the data first. That's where you can really use visuals to create, to get data across using some great visuals with less text. So that's what you're seeing on the slide here. There's on the left is more narrative, and on the right is really pulling out some visuals and helping some of the data to really pop, because you want to make sure that your report, and especially the data part of it, is consumable. So let's move into our final phase, which is implementing and tracking. And again, we're going to spend just a few minutes here because webinar number 3 is going to discuss how to effectively develop and track your community health strategies. What I want to emphasize from this phase is the importance of establishing an evaluation framework. An evaluation framework is used to assess progress, outcomes resulting from individual strategies and interventions, and then determine collective impact achieved in relation to community level indicators. So why is that important? Well, community level indicators can take time to change. And so considering the iterative nature of the CHNA process, or the assessment process, which is relatively short for hospitals, it's every 3 years, it's important to be focused. A logic model is a great tool to help you build a framework to focus your efforts and deliver uncover indicators that you can track. We could spend a whole webinar on logic models, but unfortunately we don't have time to do that, but it's a great tool. So knowing what metrics are going to be measured and then having the evaluation plan in place makes it easier to track progress and measure impact. Okay, so why is that important? Well, from a requirement standpoint, we know public health departments that are accredited, they have to submit annual reports that show their progress and demonstrate plan adjustments as they move forward. And for our hospitals, there's a number of different areas where they have to report progress. They have to report it in their current CHNA cycle, reporting on what they did since the last cycle. This area is in the Schedule H, Form 990, where they need to report on the narrative on what they did. And then there's states like California where they have to report once a year on their community or community health, community benefit, or community health improvement activities. So While tracking can help us meet these requirements, it can also help us better understand what's working in a community with a community program and where adjustments need to be made. And sometimes we're focusing on spending so much time completing the comprehensive assessment process and creating the plan that we forget how important it is to actually track and measure so that we can show a return on investment for all that time we spent. We're going to spend, again, more time on this in phase 3 of the, we're going to spend more time on this final assessment process on the webinar number 3. We're going to move to question and answer, but before we do, I'm going to pull up this slide that shows you when our next 2 webinars are, Thursday, March 11th and Thursday, March 25th. It's going to be a very similar format where we're going to try to breeze through a lot of information in 30 minutes so that we have time for question and answer. So with Zach, with that, I'm going to turn it over to you.
Thank you, Tracy and Ashley. A wonderful job presenting all of that awesome content. And as you mentioned, Tracy, we have had a couple of questions come in. The first one being, and I'm not sure, Ashley or Tracy, which one wants to take this, but how have you managed to sync up the different time frames, being that hospital and health departments have different cycles?
I think that's a good question, Zach, and I think kind of that fear of needing to sync up those cycles prohibits people from collaborating a lot of times. But we've seen successful collaborations. Some health departments have moved to a 3-year cycle to be able to align with their hospital partners who are completing their CHNAs every 3 years. Other health departments have opted to stay within their 5-year cycle, but build off or tap into the hospital assessment effort so they can still collaborate on that ongoing community assessment to kind of keep their finger on the pulse of what the community needs are. And I think that's what's important, again, as we've said, is to really set those expectations at the start of the collaboration so that everyone's on the same page, everyone ensures that the deliverables are meeting their specific needs so that they can go jointly through that process.
Thank you, Ashley. Another great question that came in, how long does it take in general to complete an assessment?
Oh, I'll jump in on this. So whatever time you have planned, assume that it's not enough time. Seriously, it's a long process, but it should be considered this kind of like ongoing process. So there's the assessment piece of it where you're gathering primary and secondary data and you're doing the analysis and all that, the prioritization. That typically you're looking at about a 6-month window to really be able to do that and do it in a way that, again, you're working with a lot of community partners, so you don't want to overwhelm them all at once. So you think about 6 months for that, but it's important to remember that piece of it to kind of consider this whole process of community health improvement. So there's the assessment piece, then you roll right into the plan development piece of it, and then that rolls into the evaluation of how are we doing, and then that comes back to assessing and making changes. So I think if you think about this as just kind of this ongoing cycle of work that you're always doing, it doesn't feel as overwhelming when all of a sudden you feel like, oh my gosh, I just did this assessment and here it is back on my plate again. Because trust me, I've been there feeling like I literally just put the binder on the shelf and here it is again. So.
And Tracy, I'll jump in there and just remind everyone that it is a marathon and not a sprint. And I think I've seen a lot of partners really go head on into the assessment process, leveraging a lot of of their finances and leveraging their partnerships, and they go really hard into the assessment, and then everyone's kind of burned out by the time they get to the implementation strategy development or the chip development. And I feel like that work plan is really the crux of actually how you move from that assessment into making impact in the community. So I would just encourage you to pace yourselves, pace your collaboratives, and ensure you're putting as much time and effort into the plan development and implementation part and the evaluation as you did with the assessment piece.
Great. That's a really good point to add. What else, Zach?
Thank you. Another good question. How do you ask questions without insulting community residents? Like we're coming to you because the data shows your community has the highest disparities?
For me, in my experience in community facing work, and that's been here in the US all over the US and internationally. I think it's more about just sitting down and having that conversation and letting it be a community or audience-led conversation. You obviously, have in mind some specific questions that you want to cover. And I think you can cover that as follow-up, but I think letting the community lead that conversation and take it where they want to, so that they feel included and that they feel heard and that they don't feel like we're just coming in to check off a box. I think it's what's it called parachute research. I heard someone use the other day where, someone comes out of their research tower into the community and asks a few questions and takes it back and doesn't really share that information. And I think it's also important to be able to, establish those relationships so that you're working with folks ongoing, have those key community partners and leaders incorporated into the process. And that, once you've done the assessment and you have those deliverables, that you're going back out to the community and you're sharing those findings and kind of reaffirming that, the assumptions and that the analysis that you've done looking at, primary and secondary data is actually, on point. And then I think having another brainstorming session with the community about how you can then go forward and begin to address some of those. Tracy, I don't know if you had added anything.
Yeah, I just wanted to add to that because Ashley, you mentioned the role of like community health workers in a community, and I just want to say, tap into those that are already working in a community and can provide some insight. And maybe if you're going in and you're conducting a focus group or you're doing key informant interviews, work with partners or community health workers that are in that community and make sure that the questions you're asking, the way that you're asking, the way that you've kind of set up the engagement is culturally appropriate and feels good for that community, what that community is used to. And I think what you'll find is that partners are appreciative when you take the time to say, hey, tell us about your community so that we can go in and we can engage in a way that feels respectful and appropriate for them.
And I would add one more thing, Tracy, as we talk about timing that it takes in planning for these assessments, building enough time and I would think finances into your planning process to be able to translate your tools, whether that be thinking about the health literacy or just literacy in general of the communities that you're trying to reach, whether that is with marketing or the actual tools that you're using for focus groups or key informant interviews or your surveys, and also taking the time to get those translated into the key languages that are most prevalent in your community. A lot of our partners at least translate their focus groups or their surveys into Spanish. We've had a few translate into Creole. So knowing what languages are important in those communities that you're trying to reach and building that into your process, I think is important too.
Thanks, Ashley and Tracy. All great information to be aware of. Another question that's come in is, what if someone has experience in certain phases of the process, the CHNA or assessment process, and they're interested in getting support with, maybe one or two of the other pieces? Is this something that either of you have done with the groups that you've worked with?
Yeah, absolutely. So again, we talked at the beginning about being flexible and understanding that every community is unique. And sometimes you go into a situation where there's a community that has strong partnerships and wonderful expertise around community engagement, and they feel very comfortable going in and doing some of that primary data collection, but maybe they don't have the access to secondary data. So we've been able to come in and help with secondary data collection and analysis. And then we've had groups that really they're looking to bring in, whether it's a vendor like HCI or another partner out in their community, to fill the gaps. Think about what are the gaps on your team that you need to fill, and then look for the appropriate partner to come in to fill those gaps as far as the different phases of this assessment.
Thank you, Tracy. I think that this next question gets a little bit to what both of you were talking about earlier, but do you have any recommendations on how to include primary data to focus on racism and social injustice?
I engaged in some of this work in my previous life with March of Dimes, talking more about health equity and racism that impact maternal health and equity there. And I think a lot of times, and again, just from my experience, people want to have these conversations, but are really unsure how to start, or are hesitant to, say the wrong thing. So I encourage you, if you're wanting to start having these conversations, there are people out there that are experts in this work and have been doing this work for decades. And so I encourage you to tap in, do some reading, do some team building on your team, kind of leading up to that process, and potentially engaging with someone that has more expertise so that you can come into those rooms and into those conversations as a participant, and you don't feel put on the spot for having to lead those conversations, and again, potentially feeling awkward that you're going to say the wrong thing or that you're going to alienate someone. But again, I do think it's about starting those conversations, and enabling those partnerships, and allowing them to be true partnerships, that it's not tokenism. We're not just coming to community partners to engage with them, when we're, trying to do our CHNA every 3 years, or our CHA every 5 years through the health department. So I think with that, people know that you're truly engaged in what's going on in their community, that there are trusting relationships being built. And you have to start somewhere, and I think it's just being open to having those conversations, and being okay being a little awkward in the beginning, and you'll get more confidence as you go. Tracy, I don't know if you would add anything.
Yeah, I just wanted to add for, especially over the last couple of years, what we've seen at HCI is actually created a health equity work group that is helping to monitor the evolution of this work, the best practices, and then sharing that with those of us that are out working in communities and working with clients, so that we can have access to some of the resources that are both emerging and have been out there and show evidence-based opportunities. So some of you may work for larger companies that have health equity or diversity and inclusion focuses. And if not, I'm sure your local health departments and other local resources that you can tap into. And of course, there's a lot of national resources. If you go back when we send the recording and look at the slide that Ashley shared around health equity, we pulled a lot of that information from national resources.
Thanks, Ashley and Tracy. Let's see, I'm looking at other questions that might have come in. Here's another question, again, relating back to conducting surveys. Someone's asking for recommendations on conducting surveys in 2021, as opposed to conducting surveys in person. Any suggestions that you all might have on reaching the underserved population, other than the ones that you've shared?
I mean, I think one hopes that with the vaccine rollouts that, later in 2021, we may have some more sense of normalcy and able to get back out in the communities. I think historically we've been really successful partnering with our clients to distribute digital surveys that are, easily accessible via, smartphones or online via computer, and then complementing that with paper surveys. We use a tracking web page for the questions, so that we're able to monitor the demographics of the survey respondents as they come in, so we can see how well they reflect the demographic breakdown of the service area or the county or the set of counties that we're assessing through that, and go out and target those communities, going to physical spaces and sharing that when we're able to. Obviously, we weren't really able to do that as much in 2020, and I imagine it'll be a challenge, at least for the beginning part of 2021, because of COVID. So again, I think with the projects that we've been working on recently, leveraging those digital surveys, ensuring that they're translated, that the literacy level is accessible, and that we really leverage those partnerships again, so that we invite community partners and leaders early on in the process to review the surveys themselves to decide which questions are going to be incorporated, and to provide feedback on the rollout and marketing of those surveys. And then they can use the tools that we've developed to do direct engagement and marketing to the communities. We've had really good experience working with faith-based communities, community organizations, federally qualified health centers outside, of our main hospital and health department clients. So again, I feel like we keep saying it over and over again, but I think collaboration and having those real and lasting partnerships in the communities can be really effective, even when trying to get out a community assessment or a community survey during this time. Tracy, would you add anything?
Tracy, you might be on mute if we can't hear you.
I think we have lost Tracy, Zach. I see that we're at time. I think we're going to be able to answer other questions specifically.
Yes.
And please feel free to reach out to us via email as well. And Zach, I think we're going to share that next.
Yes, thank you, Ashley. It looks like we're just about out of time. We of course want to be conscientious of everyone's busy schedules. So on this next slide, we've put our main contact email on the slide here. If you have any questions on how we may be able to support you and your organization, for our current clients in attendance, definitely feel free to reach out to your account manager or project manager if you have any questions following today's webinar. And thanks again, everyone, for joining us today. And that concludes today's presentation. Have a great rest of your day. Thank you.